Hello, my name is Marian Apellanis, and my presentation is on whether a gluten-free diet should be recommended in chronic autoimmune thyroiditis or not, a 12-month follow-up. So as a little introduction, we chose this because elimination diets have grown increasingly popular among patients with autoimmune diseases, especially the gluten-free diet. That's the most common one. And it is actually a well-studied, well-established way of management or diet used to manage celiac disease. So its benefits on other autoimmune diseases are being studied, and a very common one is for chronic autoimmune thyroiditis, such as Hashimoto's thyroiditis, which is the most common autoimmune disorder of the thyroid gland. The ratio of female to male patients that have this is about 12-1, so much more prevalent in females. And Hashimoto's thyroiditis and celiac disease, they both share a genetic susceptibility, but it doesn't develop in all of the patients that have genetic susceptibility to this disorder. So that means that it probably has other causes as well that are maybe due to environmental factors like diet, and gluten would be one of them. So the goal of this study was to evaluate whether a gluten-free diet can improve immunological and hormonal parameters in patients with chronic autoimmune thyroiditis without celiac disease. All right, so the population that we're looking at is 92 Caucasian women. They were ages 18 to 55, and they all had a confirmed diagnosis of chronic autoimmune thyroiditis. They all consumed gluten in their diets around 10 grams a day, 3 months or more, so at least 3 months before the study. So all of these women were already taking gluten in their diets. So nobody was chosen for this diet that had been on a gluten-free diet for 3 months prior, or within the 3 months prior. Some of the exclusion conditions were other diseases like celiac disease, as I had mentioned, any GI surgeries, diabetes mellitus type 1 or 2, any active inflammatory disease. So that could be any other, chronic disease that could cause inflammation, renal diseases like end-stage renal, things like that, dialysis, etc. And anybody on any medication other than levothyroxine or Synthroid. The control group consumed a normal diet, and they continued to include that gluten in their diet that they were already consuming before, as mentioned. The intervention group, they followed a gluten-free diet, but they were also given comprehensive education, and they were all followed and monitored by a clinical dietitian. The measures that they were taken were TSH, or thyroid stimulating hormone, free triiodothyronine, or FT3, free thyroxine, which is FT4, and then 2 antibodies, which were anti-TPO and anti-TG. And all of these were measured at baselines with the start of the study at month 3, 6, and then 12. So in this first table, we can see this just shows the differences in the groups that were studied. And we can see that they were not significantly different. They looked at height, weight, BMI. They looked at the BMI because they were stating that this could indicate that they had a similar nutrition status. TSH, FT3, FT4, anti-TPO, anti-TG. Both of these groups were already on levothyroxine therapy, so the ones that had the normal diet or the gluten-free diet, which are the 2 groups, like I said. And this would indicate that they were euthyroid at the start of the study, or at least that's what they were aiming for. The differences were seen to not be significantly different, and this would mean that then any difference that appeared at the end of the study can actually be attributed to differences because of the diet as opposed to baseline differences. Okay, so this table, which was table number 2 in the study, shows a clear significant drop in TSH levels over 12 months with that p-value of 0.044. So that one would be, if we we can look at it right over here. There was no significant change in anti-TPO and anti-TG, but we can observe a decreased or a slight decrease in anti-TPO after 3 months of the gluten-free diet. However, it's not statistically significant because it does not have a value that is less than, or p-value that is less than 0.05. FT3 showed no significant change, but there was a slight increase in FT4 after 12 months in the gluten-free diet. So we can see that right here, that slight increase over here. So in table 3, this analyzes the change in median concentrations, right? So different from the previous slide. This one's looking at the change in the median concentrations across the individual appointments. So this table again shows a statistically significant drop in TSH with a p-value of 0.039. So that's apparent right here. If we can see that. We can also see that the change increase in FT4 concentrations does actually reach a statistical significance at 12 months with a p-value of 0.022, which is right here. However, at 3 and 6 months of the observation, we don't see any statistically significant changes. So again, just these two numbers over here with the TSH again and the FT4. And in table 4, this one is, I would say, important because there is a logarithmic transformation that was done by the researchers. This was done in order to address a high homogeneity of the study, which we can see that if we return to slide 1, we can see that the differences in the group with the measures that they were looking at were not statistically different. But when you look at the confidence intervals, those are all very high. They all very much cross 1. So there was a high homogeneity going on in the study. These transformations are done in order to normalize distribution. So we've got our normal distribution curve. And sometimes there are outliers of those. So a logarithmic transformation can be done in order to make the data a little bit more suitable for analyzing, getting rid of those outliers and see what comes up then. So after this logarithmic transformation, we can see a significant decrease in anti-TPO concentrations after 3 months with a p-value of 0.010 or 0.010 right over here. We can see a significant decrease in anti-TG concentrations at 3, 6, and 12 months with p-values of 0.023, 0.019, and 0.049 respectively, right down here. Once again, we can also see a significant reduction of TSH, so that's been pretty consistent throughout all the tables and throughout the study. So we can see that over here with p-values of 0.01, 0.048, and then finally 0.000. So very statistically significant, right? Then finally, we can see a significant increase in FT4, so that's free T4, at 6 months with a p-value of 0.07, so that's right down here. And then at 12 months, it's statistically significant as well with 0.000. We do see that there really wasn't any change up here with the free T3. And the anti-TPO was apparently only significant over here at the 3 months. So these were just other important things to notate. So as per this study, it does seem that a gluten-free diet can be beneficial and aid in the reduction of TSH, or that thyroid-stimulating hormone, and it does improve the uptake of levothyroxine, which is the medication that is one of the medications that are mainly used in the treatment of hypothyroidism, in general hypothyroidism or autoimmune hypothyroidism. Excuse me. Sorry. The results of this study were not strong enough to support a significant change in all of the measures, except for that reduction in TSH, as we could see at the beginning of the study. In those beginning tables, right, TSH was the only measure that was consistently dropping, or they had a statistically significant change. However, the researchers did do that logarithmic change to get rid of some of the homogeneity of the study, try and get rid of those outliers, and that show a more promising result, right, with improved hormonal balance, with those increases in free triiodothyronine and free thyroxine, or FT3 and FT4. And that showed, it also showed a possible improvement in autoimmune balance, right, with those reductions in the antibodies that are anti-TPG and anti-TPO, those anti-thyroid gland antibodies. The results of this study, they're not strong enough to recommend gluten-free diet as a staple treatment for chronic autoimmune thyroiditis. More research does need to be done. However, it can definitely be, or it shows very promising results in using it as an alternative treatment to just your standard medical treatment, like using, levothyroxine. And it can be used for those with struggling with the management of the disease. So it could be for those struggling with the disease, or struggling with maintaining that management of the disease with medication. Maybe for whatever reason it's not working. So it is important to note that this diet could help with that as well. It is important to note that this study was done on 92 Caucasian women. And so our patient that we're looking at in our study, she is a Native American. So that could be completely different, right? So can this study be extrapolated? Can the results of this study be extrapolated into a patient like that? Also, the demographics are going to be completely different. For our patient who was a Native American living on a reserve, does she have access to a gluten-free diet, right? Or as much of a gluten-free diet as these 92 Caucasian women did, right? There are potential deficiencies that can be caused by this gluten-free diet. So how could we make sure, that a patient like that can follow this diet but have adequate nutrition at the same time? So the study doesn't completely, it's not very parallel to our patient, but, nonetheless, it is an important study that was done, and I think that the results can also be researched for our case study in this case. So that brings me to my next slide. So what are some things that we still need to know after studying this study? So one of them is, like we were saying, can the results be extrapolated to different ethnicities and populations, like our Native American female? Could this study be related or be repeated in a larger group of participants, and how would the results differ? Would they be similar? Would they be different? Does a gluten-free diet lead to sustained and significant reduction in anti-thyroid antibody levels over a longer period of time, right? So we saw how it goes from 3 to 6 months to 12 months, but we were seeing some of the results that were only significant at 3 months, right? There was one of them that was like that. Or some of them reached statistical significance at 12 months. So what happens after that? Does a reduction in TSH, an increase of FT4 seen in the gluten-free diet, cause quality of life improvements? So how does that work with, physical quality of life, mental quality of life? There's a lot of other studies that can be done with that. What's the optimal composition of a gluten-free diet to ensure nutritional adequacy and to decrease any potential side effects, such as deficiencies or, get what happens with getting rid of a large food group? What's the effect of combining a gluten-free diet with supplementation of selenium or other micronutrients? What could be the effect there? And does a gluten-free diet provide benefits in the prevention and management of other autoimmune conditions associated with chronic autoimmune thyroiditis, like diabetes or rheumatoid arthritis? A lot of these autoimmune diseases come hand in hand, right? So could this be a potential treatment to improve some of those as well?